இதால் வாங்குவோம் வெட்டேக்க இதை எடுத்து போடுவோம்.
For granting this moment and marking this important milestone with us. We now come to the official opening of Jaffna Day Surgery Center. May I kindly invite Dr. T. Satyamurthy, Director, Teaching Hospital, Jaffna, and Professor Rajendra Swaindrakumar, Dean, Faculty of Medicine, University of Jaffna, and Dr. Karunyan Avalananda, representative of International Medical Health Organization, Consultant Media, to please come forward at the window and officially inaugurate the Jaffna Day Surgery Center.
Wait. Thank you, sir. Ready, sir.
We thank them for honoring this occasion and marking this special moment. We now invite all our guests to take a guided walk through at the Jaffna Day Surgery Center, explore its facilities and services. Following the tour, we welcome inviting you to join for a refreshment and meeting with comprehensive staff.
After preparation, patient will be taken to the theatre. It's the main.
Actually, building contact government through higher education part, not all these things we got donations. So we organize those things. Now we are managing. We don't have mandatory
Equipment also
already because they supported industry because they have a vet. Vet team they usually go and all this something. So they paid from the
But the equipment will be maintained by even all over the land, everything is to them. We are helping them and also they are getting and the whole equipment, everything common because as you know the failure involved parallel. So that but good thing we are handing over each car with this one. We are getting the Australian and the Internet Club. interested in foundation. This one they are also helping almost from the center.
Phase 2 they are going to do. That is your idea. Yeah. Now currently they set up and two things. They are coming over to these two we are taking and the program also is very open. Anybody of our agenda is Google registration.
How are going to manage the daytime only?
Currently, pilot studies daytime, then we can extend if they want. Everybody depend on the demand. We can.
So the recovery, everything is inside.
Yeah.
And post-op also.
Post-op, we will manage the day. Then we will send them to most of them. If they are unable to send them some paper, then we have to transfer them during daytime. Yes, we have to.
Anything is hospital.
Yeah, that's the thing. In these premises, so
In this premises.
In these premises. Because this premises also, when we get the, I was the dean that time, when we get the approval, UDA sent, Urban Development sent, to make it a one room. And we make it, even though practically it's belong to university, but we make it, I think during Ajit Mendy's time, Dr. Ajit Mendy's DDHS and Viman Sripala district I was involved and they have given a letter. Practically considered as a one
Because I'm very close.
but most of the other hospitals they are handing over the India block. Here the problem is administrative other departments are there. Only one block is there. That is the reason we want this block to handle.
We got the upstairs.
Yeah,
The other one also
upstairs.
we have a diagnostic center. He is the person now when he reported me.
They are very helpful. Director also very helpful.
He is the person who is
Again, we are very thankful to the government, earlier government, but they have given roughly about 1,100 million or something.
Yeah, then also later in the last 2024 budget we got around 100 million to all the gas.
And actually, after this whole problem, 4 decades, we don't have any buildings, new building. But then Prof. Mohan is advised my good friend and time he was the chairman for the UAC. One day he gave me a call priority to come to the parliament. Tomorrow the day you have to be there. So we went and he We'll see how technically it's possible for us because
My surgery problem.
then other crowd also are
And a lot of interior development, that is mainly the trolleys and others from the development. I said as a Australia.
Australia through donation.
So simultaneously you can have two.
Yeah, anyway, we are starting only for pilot study. But this, we are ready to start. Yeah, we have human resource and facilities.
So you have any other studies in the southern?
Yeah, we have to understand.
And also we wanted that MOU is ready. Then the problem now, the patients will be making.
Yeah, that is a big strategy. You can use audio cows. Otherwise, even audio has a very about instruments and everything. So they have a
Instruments now we are handing over.
and
But in the only operation also we discussed. It's a pilot. Yeah, pilot. So once this is successful, only they want particularly Dr. Tawan issued Professor Surgery Assistant for Medical School. Yes. So he is a current president of International Medical School. So then last December. They are all very keen in this recurring function. One of the researches we are working on the external researches. So the work was on others. And other one is neurosurgery registry. Dr. Aditya is leading and delays. We are delays. And then early childhood development is which Mendable he assesses these schools. And other one is we have rehabilitation, hospital rehabilitation, so then training process, and also we have studies with this women health. And now we actually want to use Clinology hospital for BOG is university. So now we are working with RDHS and AHS to most probably we will start like writing in really big. So they look like
Okay, welcome you all. Jaffna Day Surgery Center. From the initial concept to its present form, the journey of the JDSC reflects commitments, collaboration, and a strong focus on safety, efficiency, and accessibility for our patients. This center stands as a milestone in strengthening day surgery services and advancing healthcare delivery in our institution. To take us through this journey and share how the JDSC came to begin, may I now invite Professor B. Balagobi, Consultant Urological Surgeon, Faculty of Medicine, University of Jaffna, to speak to us.
Good morning. Welcome to the commencement of pilot project of Day Surgery Center. And we all know this is going to be a first project, Day Surgery project in the government sector of Sri Lanka, with dedicated Day Surgery Center. So I will quickly go through the journey and I will explain the concept so everyone will understand. Because this is a new concept, most of the public and even doctors and some surgeons doesn't know this concept because it started about 25 years back. But it's all over the world. The advantage நன்மைகள் தீமைகள் எல்லாம். So I will go what is day surgery? It's a planned procedure and patient admitted and operated and discharged on the same day in a dedicated setup. Because we are already doing this kind of surgery in the hospital. Patient come in the morning and go in the evening. But we are not doing in a dedicated setup. So it's a different concept with a dedicated team and dedicated place. And the patients are not entering the main hospital. So patients come in the end and doing surgeries in the end and going home in the same end. So what is the advantage? The advantage are the patient recovering at home. So they feel better. And already you know in surgical wards in the casualty days, about 20-30 patients will be in the floor. But the hernias and varicose veins and lumps and bumps, we have to keep in the bed because it's a post-op patients. So what we can do by doing this, we can reduce the congestion in the main hospital. Also we can increase the bed availability in the hospital. And also we can reduce the cross-infection. You do some surgery, clean surgery, but there may be a patient with cellulitis or bad wound, there is a risk of cross-infection. So advantage to the patient. And what is the advantage to the healthcare? So when you have a dedicated team, we are reducing the waiting time. It's difficult because now we are only starting the pilot project in a small scale. But in the long term, we can reduce the waiting time. And actually it will reduce the hospital expenses. How? We are not going to keep the patient overnight. We are going to discharge the patient early as possible. So the hospital expenses to keep the patient in the wards will be reduced. So hospital expenses will reduce in the long term. And as I said, hospital acquired infection will be less. Now, what is the other advantages for the government and the country is in long term, not now, if it's going very well, if we have more space in the theatre, we can do it for a diaspora or anyone coming outside, and we can generate small amount of money that we can use for the hospital development, right? So at the moment everything is free, but I'm talking about not for the public, right? Anyone coming from outside, dual citizen or someone, so we can promote the health tourism, because diaspora people want to be in their place with their relatives to recover for a minor surgeries and intermediate surgery. So it's good for the country and good for the region. And already the center is collaborated with SingHealth, Singapore Health System. And actually this concept was reviewed by Professor Tian Yun. He's the MD of Singapore General Hospital now. And our regional collaborating center we have next, this is the only regional collaborative center of Singapore in South Asia. So they are going to share their technology. They are going to share how to book the patient. So here the patient is the priority, and all the surgeons and gynecologists and anyone doing the intervention will have an equal chance. And this center will be given to the hospital to manage, right? The university already have built their building, and they have developed the interior, and they are paying the electricity bill and the water bill. But the hospital will take over, and hospital will decide how to run, and hospital will decide how to give the priority. But all the people will get the equal chance, because it's a booking system. Whoever has the patient, the online, they will book and they will do the surgery. So the benefit will go to the patient, right? So, and already we have trained 30 people. We have given a perioperative care course. We have given the NPQ4 certificate by the university 6-month course. So we are going to give the opportunity for them. So university have advertised for healthcare workers and the nurses. So there will be interview with interview panel, and they will select the best people. So we are creating the more opportunity, and the payment will be given by the International Medical Health Organization. So they have promised they will pay the healthcare workers and human resource payment for 2 years, because we know that hospitals have a difficulty with the nurses and doctors and healthcare workers. But our health ministry know this project, is already discussed with the secretary, and our honorable members are here. They will make sure in the long run not to impair the already affected the crisis in the hospital, and they have to create more cadres, and they have to allocate the people to here. But till then, IMH have promised they will give any amount of the money to recruit the health staff, so we can run this course. So it's not going to affect the hospital. The benefit will go to the patient. One of the beauty of this project is the hospital is involved, university is involved, diaspora is involved, and the Ministry of Health is involved, and the Ministry of Higher Education is involved, and the patients also involved. Today we have a patient public forum members, and today we have the Impact Professional Association's treasurer and secretary, and so public is involved in this project. So actually I am requesting the ministry, in future you involve at least one member of the public in the management committee. So then we can get a better outcome, because consumer is a patient. The final outcome goes to the patient. So whoever getting the benefit should be in the management committee. Not only the doctors, not only the hospital administration. The patient representative should be there. It is already, it's functioning in other countries. So please take this as an opportunity. So, and we are going to do lots of the workshops with Singapore Health and other countries. So it's going to be a big project. But remember, we are starting like grade 1 now. We want to get the MBBS. It's a long dream, right? So don't give a pressure and don't think it will be successful immediately. We are in the grade 1 now. We are going to start 1 theatre, local case, 6-month piloting. We will see what are the problems and we rectify. If it fail, any problem, we will discuss as a team. We will do it. Right? So we are in the grade 1 now, so we have to remember that. So already in casualty days, this is the situation in some of the medical and surgical boards. And it's a real situation in our casualty theatre at the moment. Here is a patient with the scrotal surgery waiting. Here is a patient perianal surgery. Here is a patient undergoing an orthopedic procedure. And the main OT we are going to appendectomy. right? Yes, we have a limitation of the doctors. I have to thank that this region is, and the healthcare workers are doing a better job than any other district. I can promise that. I have worked in all over the Sri Lanka, but we are working with limited resources. We have to thank all the healthcare workers, doctors, administrators, nurses, everyone. Because we are, just seeing, we are clearing the crowd, but this is not ideal. This is not ideal. The day surgery should be, patients should come, we have to check the safety checklist, we have to educate the medical students and the postgraduate how to do the procedure, and patient privacy should be maintained, and we have to give the standard of care like any other country. We are not inferior to anyone. We are not inferior to any private sector. So the patient have to feel they are in the private sector. So we have to reduce the gap between the ideal section of facilities and our poor patients. So that's the situation here now. So we will improve. And also you can see patient coming overcrowded in the hospital. Unnecessarily we are, hernias and lumps and bumps and outpatient procedure. They should not go to the main hospital, right? So you see, some acute patients are in the bed, chair, getting the IV fluid and IV antibiotic. But some patients underwent surgery for intermediate and minor surgery are getting a bed because they are in the final anesthesia. They are recovering from general anesthesia, so we can't keep in their chair. So this kind of thing, if you are doing here, we can improve the setup. So we know there's a big waiting list for some specialties. While waiting, some patients die. While waiting, some organs die. For example, stone patient, waiting list is like 1 to 2 years. Right? So when we do that, we can reduce the waiting list, but that's not the promise. It takes more time. So if you want to develop the Northeast, you develop this region, the country will develop. Right? So we just not only focus the health system, we are focusing on the education, we are focused about the women empowerment and unemployment. We have to improve our airport transport system so more tourism will come here, and in the future we can do the health tourism. We should not fight for everything. Water project, Rana model, indoor stadium, cricket ground. We always oppose things. That's good. But we have to get the positive things and we have to move on. So last few months, I was having the sleepless night. And yesterday they said to do the presentation. I said, sometime I develop a heart attack tonight. So I kept a standby person. So he will do it, right? And Professor Surendravan brought a small motto from Colombo faculty. Whatever we do, we should not do for this generation. We have to do the things for the next generation. Okay? So I can die, even today I can die, can develop heart attack. Of the happiness of this opening the research, I can develop a heart attack. I can develop an accident, but this advantage should go to the next generation. Yes, we have different, but we have to discuss and move on. Right? The problem in our society is we have +3 who have lots of energy, lots of positive energy, but equally we have -3. But they are very good, but they have negative energy. But if we combine these three, +3 and -3 become 0. What I am saying is all are very good, all are intelligent, all are physically very good. But we have a different opinion, but both are equally effective. If one is +3, other one is -1, it will be +2. The problem here is +3, -3. So please, +3, -3 become +3, we'll work together, right? So I can guarantee I don't have any conflict of interest, and people are involved not having the conflict of interest. But this is a concept. We will go for a concept, discuss for a concept, not for the person. So this was a Palali Airport in 1981, 45 years back. 45 years back, international airport, second international airport. But the current condition now, you can imagine. So we are 50 years behind. 50 years behind. No one is going to come and help us. we have to work together. The government is ready to support, ministry is ready to support, but local team have to work together. So, the social development goals of the WHO, if you do it, this region will develop and the economy will develop. At the moment, we are 4.3%. We are the lowest in the whole 9 provinces in the economy, GDP. So we can improve the GDP, the country will develop. So lots of SDGs, so we are just targeting on health and education and the women empowerment, all are related. As a health professional, we can do lots of things, but all depend on the teamwork. So this was opened in last year, 2024, by the former president. And this is a floor, ground floor, we are having the day surgery. And this is the inferior, already you have seen, main theatre, mini theatre, and the initial recovery, reception, waiting area, changing room. And this will be the phase 3 IVF theatre. You know, in North Province, we have did a research and we found subfertility is 1 in 5. High rate, we don't know the reason. So just imagine, we are doing everything as a male subfertility specialist. We are doing everything and then no baby. Some people have the money, they give 25 lakhs and do the IVF and get the baby. People don't have the money, they stop there, no babies. Very painful, very painful. So in the government sector, we don't have IVF facility. Recently started in the castle, but it failed. But long run, if you start this and help these people, just imagine giving a baby, a suffering family. Not only it's not baby, its whole family is affected. The whole village is affected. Everyone is asking, you don't have baby? Psychologically, the pain of that, you all understand. The phase 3, we will start the IVF facility. If we start and run well, again it will be a successful project of the Ministry of Health. So main OT and things said. So we are in the piloting. Just remember in the grade 1, starting in 1 theatre, only starting ASA 1 and 2 patients, good patients, healthy patients, no complications. Because safety is very important. So many safety people have reviewed. The instruments are reviewed by the technology team. The consultant committee have reviewed the patient safety, and the bacterial department have reviewed the bacterial things, and the Singapore Health have reviewed the technology part. And we are having another meeting in March with the Singapore Health, and Prof. Tang Yun have reviewed. So everyone have reviewed, right? So that's safety. And phase 1, if this goes well, then phase 1 intermediate cases under spinal and GA. And phase 2, laparoscopy and intervention, and phase 3 will be ART and AVF. So, and more details are there, but time constraint, I'm not going into what's the plan of phase 3. But anyone interested, I can forward this presentation. So what's the flow of the patient, and what are the surgeries? We can do lots of surgery under local anesthesia. General surgery, orthopedic, urology, vascular, pediatric, plastic, gynecops, neurosurgery. Lots of surgery we can do at the piloting under local anesthesia. But I have to thank, so 3 goals of this day surgery. One is patient service delivery and capacity building and teaching and the research. So not just doing surgery, right? So it's a dedicated system, not crowd clearance. Purpose is not the crowd clearance. So the first meetings in 2023 and so many meetings, it must have about 50 to 75 meetings. In this country, to do something, we have to have meetings and meetings and meetings. And even in 2024, the previous president said, go ahead, and they will support, but they didn't do it, right? So many letters with the Ministry of Health, the Ministry of Higher Education. I have to thank the Ministry of Higher Education, the Vice Chancellor, and the Registrar and the Bursar. 50 million for gas line, and another 20 million for a dose, right? And he's the current MD of Singapore General Hospital, Prof. Tang Yun, and he helped and advised us what are the problems will come, and he had given the technical advice. And multiple meetings with Prof. Thawang Thongvithpillai. He's a catalyst. He's a catalyst of everything. The IMHO, not only IMHO, so many other people have helped us. Australia Medical Aid Foundation, and doctors from the UK, and Jaffna Medical Faculty Overseas Alumni, and Dr. Sanji from the GP from UK. So many people have involved. It's a teamwork. I am just boasting myself. I didn't do anything, but we have a bigger team here. I don't want to mention the name. There are lady superstars are there, and lots of other people are there, and it's a teamwork, not one man's work. So many meetings. We went to Singapore and visited the day surgery, and we got the advice from them, and they educated them. We have a regular meeting, and we went to the diaspora in Singapore. He's the guy who operated through Gotabaya Rajapaksa, the bypass. He's a cardiothoracic surgeon, and our embassy representatives are there, and doctors from Singapore are there. A multiple meeting, endless meeting, so many Zoom meetings. And IMHO have given lots of support, and we are doing a community cancer screening. So any early cancer we can do it here. Dr. Dhanendran team is leading this in northern province. If it go well, we can do it in other parts of the country. And we have trained 30 people for perioperative care course. It's the first time in the world perioperative care course given by the university with the 6-month course, the MDQ4. Next is we are giving a job opportunity for them. Right, they are unemployed and more affected people, usually mainly the women people. So we are giving support them, and phase 1 is supported by so much of instrument. Let's take OT table. How much is the OT table? It's 10 million. OT lamp 7 million. Anesthesia machine 20 million. The scan machine 20 million. So so much of money, but luckily we are not involved with the money. They buy the instruments and they give it. So there will be a transparency. So we have to thank this man from Thambi Pillai, the USA transplant surgeon. He initiated the transplant surgery, live donor transplant surgery in Jaffna Hospital, and he's a president of International College of Surgeons. His one of the dream is how to establish a day surgery center in Sri Lanka. And they are not only doing the projects in Jaffna, they are doing all over the country and all over the world. As a president of International College of Surgeons. So we have to thank him, and this is soon after the first live donor transplant surgery, and you can see Dr. Madhivanan is here, and then we have given the felicitation recently. So it's a big team. I can go on like this, but because of time factor, I'm stopping here. Thank you very much. Please give the support. We will move forward as a team. Greater Jaffna and greater country. Thank
you. Now we request for the blessings and few words for JDSU. First, we kindly invite Dr. Suranga Dalmula, Deputy Director General, Education, Training and Research, Ministry of Health, to share his blessing and few words for JDSU.
Thank you. Dr. Satyamurthy, Deputy Teaching Principal, and Dean and the other senior lecturers and consultants of the university, all the supporting donors and health staff and the public and ladies and gentlemen. So let me thankful for the first speaker. He has given us a comprehensive description about the work. So it's really good. We have witnessed the work as well. So for me, it's really a fourfold investment. The first one is the collaboration. I'm so much happy about this particular collaboration. We are the Minister of Health, Minister of Higher Education, and the Teaching Hospital Jaffna, and the Jaffna Medical School, as well as the other international and global donors. It's a really great collaboration. It would be a great example for the other part of the country as well. The second benefit is the daycare surgery concept. It has been attempted several times, but it failed due to several reasons. But I think you have understood all these issues and you have made a nice plan. For me, It's really a good plan. It started in the pilot, then the phase 1, phase 2, and thereafter we are going to have full-fledged. But what I noticed over there, especially everything is going with the collaboration with the university and the hospital. So it's really a good initiative where we can really minimize the issues. So third benefit is for the public, as he mentioned, about the daycare concept ultimately benefited by the public. But for me, the other benefit is the health system. So this is going to enhance the strength of the health system. For me, as Deputy General Education and Training and Research, where you have got, especially I have seen there are some education part, training part, as well as research part as well. So everything together is a collaborative and very successful program. But from my working, so I need to really make a sort of forecasting as well. So I know that it's going to be a very great product, but we need to mitigate the issues as well at this moment. So the main thing is the manpower, especially anesthetists and the surgeons. But here the advantage is we have got another set of clinicians from the university, so it can be really powerful. As well as not only the high school clinicians, we have got an issue with the middle and lower categories as well. But someone mentioned that you have a plan for that, since you have trained 29 perioperative health staff, as well as you have a capacity of recruiting somewhat like a contract basis. And my particular suggestion is those who are willing to work voluntarily, even retired, they should give a chance. So in the government proceedings, little cumbersome to recruit someone retired, but we need to be really at this moment as well as I don't know whether we can open up the sort of pathways from the university rather than coming from the ministry in terms of the getting some support staff. So all in all, it's really a good project. I need to thankful, especially for the university and the teaching hospital, as well as all the donors and general public who have immensely contributed to this great thing. But the final note is really, I'm so much happy about the previous speaker. You have gone beyond the health in terms of the development of this peninsula. So yesterday I went for a small gathering here at the College of Association of Plastic Surgeons, and where I went back to my place around 9:30. What I noticed, it's a live city. At that time also I have noticed that several shops were open, even the restaurants and all. But when you go to Kandy, it's not. It's really close by 6 or 7. But it's really happening place. And I have seen a lot of foreigners and even diaspora all over the Java. It's for me, you can go to the maximum level since you can improve the GDP. No worries, since you have a small amount of population. So if you enhance the GDP, the income or the gaining small bit, you can go for as long. The denominator is the number of people is less. You can have a high level of GDP. I know that if you really work together, it's not a difficult thing. So all in all, it's really good endeavor. So I wish success with this project, and for the gathering and the organizers also really I enjoyed the appreciation. And finally, I wish all the best for this particular endeavor and have a great day. Thank you very much.
Thank you, sir. Next we invite Dr. T. Satyamurthy, Director, Teaching Hospital, Jaffna, to deliver few words for JDS.
Thank you very much. I am Dr. Salanka Dalamula, DDG, ETNR, and Professor Surendra Kumara, Dean Faculty of Medicine, and all the professors, consultants, doctors, and especially representative from overseas organization and all the staff here. And it will be about to have these facilities adjoining to the teaching hospital. I always consider as it's a part of teaching hospital. So when the department moved to this place, so there were the previously occupied places were handed over to us, and then we had a chance to put new department and work at our hospital. So whenever university trying to develop the facilities, so I always encourage giving all the necessary support, because directly, indirectly, this will release the pressure of hospital. So I'm sure Professor Bala Gobi worked very hard. So he invited several meetings here. So he worked with team. I notice here. So in a scientific way, everything systematically planned and executed. Therefore, I don't need to tell much about this center. I'm sure this center will be function one of the best service providing center. Hospital always will take the responsibility there. So as the director and my staff will take the responsibility to maintain these facilities and giving all the necessary support for further development, because now they are doing research and they are submitting, and these will I submit the Ministry of Health, authorities are here, witness here. So therefore this collaborative effort will witness the older public also. So on behalf of the hospital, so I should thank especially the dean and the team, and with the donors also systematically approached, and the millions of money received proper way, and the program will be a very transparent. Therefore, now I have asked Professor Balagobi and the other dean also to run some other program too, like perioperative care is very helpful. And now there are trained people now we are using at hospital. So these organization now only I can understand. Usually when I was graduated, I thought the organization producing doctors or producing graduates, but ultimately university so they have to research for the people problem, and they have to give the solution because they are the scientific organization. So this is the way university should function. So on behalf of hospital administration, all this stuff. Thank you very much for your good. Thank
you. Thank you, sir. At this moment, we invite Professor Rajendra Surendra Puran, Dean, Faculty of Medicine, University of Jaffna, to share a few words.
Good morning, and Dr. Surendra Puran is Deputy Director General of Education, Training and Research, Ministry of Health. And Dr. T. Satyamurthy, the Director of Teaching Hospital, Jaffna. And Dr. Raviraj is the former Dean and currently the Commission Member of University Grant Commission. Mr. Kantiman, the Registrar, University Jaffna. And Dr. Karunia, he was my teacher then during difficult time. He visits regularly and was teaching pediatrics. So he's a pediatric endocrinologist, and all of my teachers and senior consultants, professors and lecturers and staffs and students. So we have already, I don't want to take that much of time, already here that explained very well. But the important thing is, as a kind of a university, we have a thing, this training, research and service. But the training without the service or research is not useful. So that's where that when you consider as a country, Sri Lanka, we got all these resources. But in the post-independence time, our progress in science and technology and the service quality things, we had a very good foundation, our forefathers post-independence, very good health system. When you take the health system, this is all considered as a best system. One of the things when we consider as a allocated GDP outcome. So unfortunately, then we are not able to incorporate and grow. So it's a right time and all things. Last week I was in two places. So one is the Jayawardena University Medical Faculty. They opened the Institute of Allergy and Immunology, and also I was with this University of Colombo that starting that Sri Lankan National Genomic Network. So all this function I also showed is Dr. Dolamal was there. So very important that to work closely working and collaboration to develop this kind of training, particularly the research and service. Then with the local knowledge, we should be able to improve the training. So we can have a world-class doctors and nurses and health science professionals. So which is one of the area I see, I am very much keen. The Sri Lanka is one of the potential country for kind of education and health tourism. Because now that Sri Lanka, we are promoting a lot of tourism, but that's rather than that kind of recreational tourism. We have to think about some of these, because it can bring a lot of dollars and money that can improve our GDP. So we need to grow very quickly. We have to look at this, our neighbor countries and how they are growing very fast. Even we have to think about Vietnam, Indonesia, Malaysia and things. So they are contributing a lot. So as a country, it's a time for us to work together and develop. So, and also I see this, Jaffna has a lot of potential because we have only the 1.2 million population here. Same amount of population is living all over the world. So even if you can attract them to come here and get the services and also some kind of education. So we are really struggling to get the foreign students to come here and study. So these are the avenues, definitely then we can provide better health care for the people and also the better education for our next generation of health professionals. I think this is maybe one of the initiatives we need to do many things, and all the investment now because this invested by the education ministry, we had to utilize that place because it's public money. So if we are not utilizing that, then really a waste. This way that many places the government has spent a lot of money, but we are not utilizing properly. So we have to see how we can utilize. We have to go for partnership and use the resources and develop that. That's what is a model. Thank you so much for all help, because I am as like a facilitator, but then others all contributed well. And then in future we hope to see more avenues and more things for our betterment of the people in Sri Lanka. Thank you so much.
Thank you, sir. We kindly invite Dr. Karunyan Arulananda, representative of International Medical Health Organization, consultant pediatric endocrinologist, to give a brief blessing message.
Thank you very much. Dean, Dr. Surendra Kumar, Dr. Santhyamurthy, it's a great pleasure to be here. I grew up in Jaffna. I was born in 1942, for all of you have thought about perhaps. And I studied medicine in Colombo from 1960 to 1966. And though I left Jaffna many years ago, Jaffna never left me. And so here I am back again in Jaffna. And it's a great pleasure. And to me, the greatest pleasure is to see the work that's done, the collaboration, the concepts that Dr. Balagobi talked about, the progressive attitudes and utilization of all resources to bring about this very, very new, wonderful concept. It's a concept that is practiced where I come from, in California. It's more cost effective, much better for the patients, as Dr. Balagobi so eloquently said, and it's a concept that's time has come. But the way in which you have done it, with the collaboration, meeting, talking to people, and most importantly, taking the patients into consideration, has been very exemplary, and I'm very, very proud of you. From the point of view of the IMHO, they are very keen on you, and Dr. Tavam Kamipula, the professor of surgery in Stanford Medical School, is a transplant surgeon, and now the president of the International College of Surgeons, is very keen on this. And he has been telling me, this has to go and speak, please go to the opening session and meet people and talk to them. So on the whole, I'm very pleased, very excited for you all, and I think this will be the first of many, many things to come. And maybe this is a project that can be an example for other parts of the country also to follow. And so on behalf of IMHO, thank you very much to all the organizers for doing a project that's well done on behalf of the IMHO too. We are very grateful for what you have done, and our best wishes to you as it goes. And I'm sure you will succeed. Thank you very much.
Thank you, sir. Next, we kindly invite former Chair Professor S. Raviraj, Faculty of Medicine, University of Jaffna, to give a brief blessing words.
Dr. Saranga Dalamulla, our Ministry of Health representative, Director Dr. Satyamurthy, Dean Dr. Surendra Kumar, Dr. Karunian, Registrar, and my colleagues, nursing officers and friends. It's a great occasion because we have sweated, all of them, sweated for several years. I want to recall one or two things. This at the moment, former Dean, Mr. Balakumar, Dr. Balakumar is not here, and I can remember he has sweated a lot with us. I think more than Kuman and Peter and lot of crowd sweated during that time to get this land. I think we have to thank for the municipality and the mayor at that time to give this land, first of all. Then I have to thank our government at time, as well as Professor Mohan D. Silva, the chairman, former chairman, UGC. Those are the two main persons who helped us to get this land for us. That's a great thing. And later we have to thank our Ministry of Health, because they are very helpful in every time to help to develop this daycare surgery, as well as during that time, during the building, we had a problem. Somebody may not know that this one, UDA has the problem by the side of the hospital, and they asked us whether you can accommodate the whole area as a one part, but you can have two ministries. Then our Honorable Minister that time, as well as Dr. Ajit Mendis, I can remember, they are very helpful, and they have made it as a written letter that it considered as a one compound. And very thankful to IMHO and other organizations, those who have helped us, NGOs and other things, to build this in a fruitful manner. And personally, there are few consultants. I have to thank them. One of the person is our former, you know, most of you in elderly people, he's Mr. Naganathan, Dr. Naganathan. His son helped a lot for us. He's a former GP. And like that, lot of people, sorry if I made anybody missed, and we have to thank Singh Health also. And I hope this will be very fruitful one in future, and wish you all the best for the future development. Thank you.
Thank you, sir. We kindly invite Chair Professor Geetanjali Satyadas, Department of Pediatric, Faculty of Medicine, University of Jaffna, to share a blessing message for Jaffna Day Surgery Center.
Thank you. Good morning to you all. It's actually a pleasure to be with you all here today and witness one of the important milestones in this surgical specialty. I would really like to tell 2 points here. One is because we have, when you look at the social media and the media, nowadays we see quite a lot of doctor-patient relationship is hampered. They are being accused of certain things and we have been pointed fingers at. So I think that point can be ironed out a lot by this type of ventures where we can work together and enhance patient care. And because of that venture, we should be able to work out much more feasible relationship with the patients. And I kindly urge our ministry representation to expedite these MOU procedures and make it a working arrangement conducible for all the consultants here and let them also take part in this important venture. Thank you.
Thank you, ma'am. As final talk, we invite Chair Professor K. Mohandan, Department of Obstetrics and Gynecology, Faculty of Medicine, University of Jaffna, to share his blessings.
Good morning. Welcome to the invited guests and representatives of the IMHO, my colleagues, staff, and also the representatives of the public. So again, it's a milestone in the collaboration between the Ministry of Higher Education and the Ministry of Health, that is the Teaching Hospital Jaffna and the Faculty of Medicine. We don't consider this as a collaboration because I consider both of us as the one and the same. Because when a patient enters the hospital and gets treated, the patient doesn't know whether you are being treated by a health ministry consultant or a university staff. Similarly, when a patient comes and gets treated here, it is the same. So that is what the public perceives. Number two, the concept of day case surgery or one-day surgery or the same day surgery is, someone said it's new, someone said it's old, but it's an old concept. It has been there for more than 2 decades and developed systems like the NHS, and what they decided was they should have a dedicated location for this. So as somebody, emergency surgeons and even the gynecologists said, we do day case surgery on a daily basis in Jaffna, but not in a dedicated place. So because not doing it in a dedicated place, it takes the space of other patients, critical patients can be neglected. So having the concept of day case surgery in a dedicated place, I think this is the first center in Sri Lanka. So we are really proud of that. As I said, 2.5 decades ago, the gynecologists first initiated this step, and as usual, the surgeons joined. Because we do a lot of day case surgeries, not local, but under general anesthesia. But we know that the place is fully equipped, the state-of-the-art equipments are there, which is very important because we may not function fully, maybe even we will function to 10% initially, as Dr. Balagobi said, or Professor Balagobi said, we might be doing surgeries under local anesthesia, but the place is really not for local anesthesia, also for general anesthetic cases. That is what the real concept is. So surely our public will benefit. Yesterday we were listening to the hand surgeon, the expectations of public, not only diaspora or sort of a bank officer also might need a day case surgery, but a person who does manual work, who if he can go home on the same day, his family will eat the next day. He will survive. So it's for everyone in this society. So hopefully with time, with additional resources, maybe it will take several years, we can function as a fully fledged day case surgery center. but initially this is going to be we are going to function probably in a very low pace, but with time, one day we will function fully. So I wish all the best for the people who have worked very hard. Really, I am not involved physically or in any way in developing this place, but my blessings are there for everyone. Thank you very much.
Thank you, sir. To conclude today's program, may I invite Professor B. Balagobi, Consultant Urological Surgeon, Faculty of Medicine, University of Jaffna, to give vote of thanks.
So I have already thanked you all, but I don't want to mention the names because there are so many people who are behind us. I will miss the names because I was very busy and sleepless night of organizing these things. So I have thankful for everyone, and I'm very emotional. Thank you very much.
Thank you, sir. Once again, thank you all for joining us and making the occasion special. Thank you.
இந்த லைவ் இல்லை ஓகே கட் பண்ணுங்க இல்லை இப்போ பார்க்கலாம் நீங்கள் இந்த இல்லை நான் இதில் காட்டி வேறு ஒன்றா ரீமேக்ஸ்லேயே அந்த பண்ணுறேன் சொல்லி